Hi, I'm Dave Fornell, the editor of Diagnostic and Interventional Cardiology magazine. I'm here at the Society of Cardiovascular Computed Tomography in Las Vegas 2015. And I have with me Dr. Dee Dee Wang. She is the Senior Staff Cardiologist, Advanced Structural Heart Imaging at Henry Ford Hospital in Detroit. And I understand that your program has been very involved with 3D printing. And I wanted to find out a little bit more about what cases you're choosing to do 3D printing and how you're using that for procedural guidance and planning.
Absolutely. Well, this is an excellent meeting to begin with Society of Cardiac CT. With the 3D printing evolution at Henry Ford Hospital, we get a lot of high-risk patients that are turned down for surgery. So any kind of high-risk valve procedures that we don't have a good visualization for, we found that if we use 3D modeling and we use 3D printing and advanced techniques, we can take a patient's heart outside their body while they're at home waiting for the procedure to be planned and get a better perspective of what we're dealing with before we actually go into the case. So with this technology, we are actually pioneering new techniques to help patients have quicker recoveries, less hospitalizations, and they can go home with less pain, because we are trying to anticipate everything we need to do before they actually come to the table for the day of the procedure.
So are these patients primarily congenital heart patients, or are they solely high-risk patients?
That's an excellent question. So at Henry Ford Heart and Vascular Institute, Dr. Bill O'Neill pioneered the first structural heart interventions. We actually call ourselves structural heart. There's no differentiation between adults and pediatrics. By the time they reach us, they're mostly adult patients with failing heart valves and failing congenital conditions who have been turned down for surgery. And so this is the last resort. So we do have these patients that are extremely high risk, that have not been dealt with and people don't have any clinical experience with, that we actually use additional technologies for imaging modalities such as 3D printing and 3D modeling to get us a vision that we otherwise wouldn't have. Because when we do transcatheter procedures, we don't do any cutting. We don't have any chainsaws, we can't do any open heart. We're actually doing just plumbing and catheter work. So this allows us, without ever making an incision, to get a better perspective of what we are dealing with.
So with your system, you take CT data sets, and then you're able to reconstruct the data sets using software for the particular areas of the anatomy. What exactly are you printing? Are you just printing vessel segments? Are you printing the aortic root? Or are you printing the entire heart?
So in the past 12 months, there's been a boom in 3D printing technology. It's been very hot in the industry. The integration of 3D printing actually started with orthopedics, but actually application of it in the cardiovascular world is starting to be understood more in the recent years. And what we print is actually dependent on what the disease process is. We actually focus on what we're looking for and what our question is. So there has to be a lot of clinical questions before we actually go in and do any kind of modeling. If there is no clinical question, there's no benefit. So as with any new technology, there has to be a clinician behind to seek the answer. So we could be a big print like a heart, we could be a small print like a valve. It all depends on what that patient's disease is. The 3D printing and the beauty of 3D printing is personalizing medicine. You know, 2025, 2035, we think genomics is going to be the next wave. Well, we can actually beat that. In the next 5 years, there's no reason why we can't personalize a procedure for a patient or a heart valve, now that we know exactly what your size is going to be.
And with the 3D printing, what are some examples that you've had at your facilities so far that have helped answer some of these clinical questions? So
we've actually implemented 3D printing in our complex structural heart interventions, transcatheter mitral valve replacements specifically, so that we can actually get a better view of their anatomy and how it integrates with other parts of the structure. One of the things in cardiology as a clinician is we want to see the interplay between different parts of the body. And with this modeling, we can get a whole perspective instead of a static image that we see in a 3D viewer. These are non-surgical candidates, so everything we do is through a catheter that goes to the patient's groin up to their heart and do the procedures. So we do a lot of this on these patients. We have actually done quite a few cases on patients who've had difficulty with surgical repairs and poor healing with aortic grafts too. And in that sense, we can localize the anatomy better for the surgeons and for the interventional cardiologist.
And with the transcatheter mitral valves that you're using in trials, there's a lot more at play as opposed to an aortic valve, and left ventricular outflow track, and you have a shorter landing zone. Are these all important factors to take a look at before your procedures?
That's an excellent question. There are a lot of factors that we need to put into play right now. So 3D printing is just the beginning of our understanding of it. And there's a lot to still be accomplished in research in the next few years. But this is an excellent starting point that we haven't had before. And our current technology demands more. So with this, it's just a bonus add-on to our peri-procedural planning to improve patient outcomes and patient safety.
And From a technical standpoint, how do you have to use this particular software? What software do you use, and what type of a printer do you use to make your models?
So there is no one stat system that we can use right now. What happens is patients come in for an outpatient traditional CT scan, and when they have that CT scan done, then we go ahead and post-process the images. And when we find the techniques that we want and the area of interest, then we make a modification and 3D print of it.
Great. Well, thank you.
You're very welcome. Thank you.